Topic is Hodgkin's lymphoma. Hello dear students, we'll discuss a clinical case, often kept as a short case, sometimes long case, and we'll be discussing a long question in theory, short questions in the management aspect in the theory, and Oxy they will keep, Viva, neet exam, MCQs are like very important topic. What this condition is. See that neck, diffuse swelling in the neck, rather young adolescent, probably 20-30-year-old group. So what this swelling is, it is mostly Hodgkin lymphoma. You got differential diagnosis. It may be Hodgkin lymphoma, it may be NHL, it may be secondaries, it may be tuberculosis, it may be some infective pathology, it may be an HIV patient, all those things. So these are the differential lines which you have to think of. It looks like swelling here, diffuse, very typical. It's a Hodgkin lymphoma look actually. HL is a common in children, otherwise commonest lymphoma is NHL, remember, in children HL. Commonest lymphoma is not HL, commonest lymphoma is NHL, but in children commonest lymphoma is NHL. Bimodal HL, in children NHL, overall NHL. Okay. Bimodal presentation, early age group and late presentation. Cervical nodes are more commonly involved, and real classification for lymphoma it is revised European American lymphoma classification used. All these things, B cell, T cell, Hodgkin lymphoma, precursor lymphoid. In Hodgkin predominantly HL, classic HL, precursor lymphoid neoplasm, immunodeficiency with the lymphoid, all these things. I am not going to detail it. We can always see this one and learn. You can often ask as a MCQ short note or a different type neat exam MCQs can be asked. So what is the features of, these are the features of Hodgkin lymphoma in the table. Like etiology, see that infectious mononuclear Epstein-Barr virus, HIV, SLE, RE, organ transplant, vitamin D deficiency, tuberculosis, NHL, HIV, chronic lymphoid leukemia, secondary sarcoidosis. These are the differential diagnosis, remember. Features are common in male, bimodal, smooth form. India rubber, this is very typical, remember, India rubber consistency is very typical of Hodgkin's lymphoma. Consecutive group of lymph nodes, symmetrical, and these are the two things very important. Commonest is MCQ question, cervical lymph node, consecutive group, India rubber consistency, typical thing. Splenomegaly again common, all these things are the common features. Remember. Hepatomegaly is uncommon. Examine all regional nodes important. Pruritus in 25% of patient. Note, feature very commonly asked MCQ question. B features are white loss, night sweats, drenching night sweats, fever, white loss, fever, drenching night sweats, severe night sweats. Now, pruritus does not come on the B symptom. It's very common association in the Hodgkin lymphoma. Remember. Now, these are the three components are the B symptoms. White loss, fever, drenching night sweat. Gross, fleshy, pinkish, grey rubbery. Rees-Sternberg gent cell is very typical with owl eye nuclei, mirror image nuclei. It's the typical Rees-Sternberg cell, mirror image nuclei. LDH is very important. Definition and open lymph node biopsy is ideal because you have to do ISC in this patient 15, 30, 65. CT chest abdomen, sometimes PET CT, bone marrow biopsy, aspiration and biopsy. Aspiration different, biopsy different. Usually iliac crust is used, remember. Crust. Staging laparotomy earlier done with no role. Diagnostic laparoscopy is very useful in this patient. This table, remember, it covers everything about the features of the Hodgkin's lymphoma. And this is the staging which is used for the only Hodgkin lymphoma, unarbored staging 1, 2, 3, 4. Now suffix is currently added for liver, lung, marrow, pleura. S is spleen is very commonly involved, so it is stage 1S, 2S, 3S, for like that. All these others, B is the presence of B symptoms, weight loss, drenching night sweats, fever. These are the three B symptoms which you have to remember. Accordingly, it is classified the newer staging, additional stage, modification. These are the things which you have to remember. So problems are pleural effusion, SV obstruction, spine involvement. When spine is involved, RT is given. Infection, pneumonia, immunosuppression, risk for other cancer. There are high risk for other cancers. Mainly squamous cell carcinoma can occur in this patient. Those who had treatment for HL, eventually they may have squamous cell carcinoma, oral cavity, elsewhere also. Even adenocarcinoma sometimes. Mainly squamous cell carcinoma. They are high risk group for other cancers. That point you have to remember. And unfavorable signs are large mediastinal mass, external spread, raised ESR, forearm nodes involvement. B symptoms are unfavorable. HB less than 10, albumin less than 4, age more than 50, male sex. These are the unfavorable features for Hodgkin lymphoma. This is the MCQ question. Remember, all these are unfavorable features except, like that will ask. So you have to memorize these things, that's important. So treatment for early favorable, mainly RT plus extended chemotherapy and local RT plus extensive chemotherapy. Chemotherapy ABVD, adriamycin, bleomycin, vincristine, dacarbazine, BEPCOPV regime. This is the main regimes which are used, mainly this one. MOP regime, earlier we were using mustine, oncomine, procarbazine, penicillin is not commonly used. Now mainly current standard is ABVD. So differences are, this is the differences in these things are you have to remember. HL is bimodal, it's adult asymmetrical, symmetrical consecutive, non-contiguous, axial lymph node. So neck is commonly node, not common. Peripheral nodes commonly node like supratrochlear, epitrochlear lymph node, puppet lymph node, Waldeer ring, adenoid, tubal tonsil, palatal tonsil, lingual tonsil, adenoid, tubal tonsil, palatal tonsil, lingual tonsil, commonly node. Peripheral lymph nodes like epitrochlear, papillary lymph nodes are commonly node, groin lymph nodes are involved. Asymmetrical involvement, axial and other areas. Treatment here is mainly RT, here mainly chemotherapy, later of course we'll add on to chemotherapy. Mainly chemotherapy, RT is for bone, CNS, wide stage 4 disease, RT is involved. CHOP regime or CHOP is very commonly, rituximab is commonly used here. Here mainly ABVD. ABVD, CHOP or R-CHOP is the used here. So answer, the popcorn type of Reed-Sternberg cell is seen in HL type, lymphocytic predominance, mixed cellularity, nodular cirrhosis. Find out which type of Sternberg is used in this type is in which type of the tumor. Find out and give the answer in the comment box. I will get you back later. Most common Hodgkin lymphoma in female is lymphocytic predominance, mixed cellularity, nodular cirrhosis, depletion. Again find out and put it in the comment box. I will get you back later. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method including history taking of swelling, ulcer, hernia, immunoscotal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics including briefly trauma, how to approach, orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery. Entire thing clinical method with a lot of photos, illustrations, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis. But it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail, principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics, general surgery, endocrine, surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with the illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there. Covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast and other things, include briefly gynecology surgeries, with step-by-step illustration photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that in detail. Explanations are there. My small atlas of tissue approximation with the videos shows clearly means with the principles how to suture tissues. Dissection and tissue approximation, the two parts in surgery. Dissection is a principle, essential. After this surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that very useful thing to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram and so on. My DigiNow lectures to the JP Publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topic, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, the examination, clinical examination videos also. It covers 220 lectures, cover everything. 1 year purchase you can do. It gives detailed thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, including DigiNow and lectures. Thank you very much. So hope students, HL is very common entity. Hope you understood this lecture very well. Thank you so much.